I joined the military, I was not planning on going into medicine, but I eventually fell into medicine, and I particularly love plastic surgery in the military because of our patient population. So that's why I'm here.
Hi, I'm Dr. Katerina Gallus. I'm in private practice in San Diego, California, and I'm a retired Captain Select United States Navy Medical Corps, and I'm here with my colleagues to discuss leadership and representation in the military by women plastic surgeons.
Hi, I'm Helen Hui-Chou. I am former United States Nurse Corps lieutenant, and I am a current hand plastic surgeon in a university surgery setting.
Hello, my name is Jennifer Sabino. I am an active duty plastic surgeon at a military medical center.
Would you like to tell us why you chose to join the military?
That's a question I get all the time. I joined actually when I was 17 years old, and I was in the military for college. I wanted to be in the military because I wanted to be part of something that was bigger than myself.
I was also a college recruit, joined the military in college, mostly for financial reasons. I did know that I wanted to do medical school, but they really did provide me that scholarship support that I needed to continue my undergraduate and then graduate education. How about you, Helen?
Agreed. It's a very good financial opportunity, and same thing, I recruited in college, and I actually, even though knowing I wanted to go to medical school, I actually chose the nursing path to get more experience in the health profession, and did my time with the Navy Nurse Corps for 6 years.
Great. So what do you think women are signing up for when they join the military in the medical field specifically?
I do think that people also have an intrinsic need to kind of be part of something bigger. And when I joined, we were in the middle of a war. And so the patients that you were taking care of, were coming directly from overseas. And so you really felt like, you were making a difference.
I joined and found the camaraderie with the other officers and also our enlisted support staff and the corpsmen was just amazing.
Me too.
Yes, I think you can't underestimate the bonds that are created when you're serving with others, when you're on a deployment. I deployed as a general medical officer, so as a kind of like a baby doctor, and was on a ship where there was a helicopter accident and a trauma situation, and I'm still to this day friends with one of the explosive ordnance, one of the bomb guys from that deployment, because it was such a bonding experience.
Sure. The military is such a small community.
Mm-hmm. It's really a special community, special time, and I cherish everybody that I met and worked with.
Helen, what about your military experience made you want to go on and attend med school?
Luckily, I was able to interact with a lot of female general surgeons when I was a nurse, and they really encouraged me and were mentors for me and showed me how good it could be to pursue medicine, and so it really solidified my choices.
I wasn't necessarily interested in going into medicine when I joined the military, and I have an interesting anecdote. When I was a freshman in college, one of the surgeons who was present at Mogadishu came and talked to us, and he talked about how before the conflict happened, his main patient population were recreational injuries and shark bites, and then the conflict happened and he was operating for 72 hours straight, and that kind of inspired me again, what you could do in military medicine.
Absolutely. The beginning of the conflicts really solidified it for me as well, and we took care of some of the sailors from USS Coal bombing initially, even before the war began, and I remember how injured these sailors were and how terrible their injuries were and how hard the entire team had to work to get them, to recover and healed. And so that's also the other experience that I had that really made me decide I wanted to, at first thought I wanted to be a trauma surgeon in the military.
Doesn't everyone?
Yes.
I think everyone does.
It's the coolest.
So for women surgeons that are going to stay in the military, what kind of advice do you have for them?
I would say that sometimes the path isn't always easy to do what you want to do. I joined the military young, wasn't exactly sure what I wanted to do, but every step of the way, I was able to advance the way I wanted to. I think through persistence, through planning, and so whatever you want to do out there, whether it is becoming a plastic surgeon or becoming a Black Hawk pilot, there is a way to get that done in the military.
Yeah, I think Jen's experience is very classic, and it really does come down to persistence. If you are passionate about what you're doing, whether it's medicine, taking care of patients, it's just sticking with it despite maybe even some doors being shut in your face, and you sort of find another way around.
And that's such good advice for just women in medicine, right?
Yes,
You
in
know, it doesn't
general.
have to be in the military, but just knowing what you want to do and sticking to it.
Definitely in surgery too, because sometimes, you think you're going to spend X amount of time in a residency, then X amount of time in a fellowship, but then something else happens. Family member gets sick, or your significant other changes jobs, something just changes, and if it's what you want to do, if you're flexible, you're going to get to that end point.
I agree.
Let's talk a little bit about gender bias. It exists in medicine and surgery, and then obviously it exists in military medicine. Can you give us an example of some leadership challenges that you've had and how you face those challenges?
I don't think I have any experiences unique to the military as far as gender bias, but throughout my life and training, I have experienced that type of bias. I try to combat that by being assertive but respectful, and it seems to have gotten me, far up until now.
One that stands out for me in terms of gender bias was actually when I was deployed with my fleet hospital to Guantanamo Bay, Cuba. And I was told by my senior leadership that I was being sent because I was a woman, and that the detainees and the prisoners of war that we had captured did not like women to have to take care of them or have contact with women.
Yeah, that must have been really hard. So how did you deal with that?
We just tried to remember that culturally they are not used to women contacting them, and also certainly in a leadership position, which I was at that time in the fleet hospital. And so, I used translators for letting them know that we're about to do this X, Y, and Z procedure on them before we would touch them or change their dressings and things like that. But it was interesting because it did carry over for me when I was in residency. We also had patients in our residency hospital from the UAE and Saudi Arabia with flying over to the US for care. And same thing, it would be could be a male patient, and they didn't want the women touching them as well. So I would have my junior residents on rounds, even though I was the chief and sort of responsible for seeing these patients and ensuring that they were doing well post-operatively, have my junior residents sort of be my proxy. I'd just stand outside on the door, listening and making sure that the patients were still being taken care of properly while still respecting their sort of gender boundaries and their culture.
Yeah, that sounds pretty challenging because you want to deliver the best care possible.
Absolutely.
But I think keeping the patient informed as you go on step by step is probably really helpful.
How about you,
Excellent.
Dr. Gallus?
Yes, the same. I feel like if anything, sometimes you're underestimated a little bit, and so can be challenging to constantly have to prove yourself. But again, you just demonstrate effectiveness by being who you are and practicing good medicine and being respectful and responsible, and that really goes a long way.
I agree.
Okay, so let's talk about another topic that impacts women in the military that's more personal, relationships and family planning. Any tips on family planning in the military?
I'm married and I have 2 small children, and the military has definitely affected not only myself but my family. But I always knew that I wanted to have kids, and for anyone who is in medicine, there is never a good time to have children, right?
That I can agree with.
But if it's something that's important to you, you will make it work, and you will still get all of the other things that are important in your life done as well.
So did you have your children during residency or after you were already a surgeon?
I had my children during my plastic surgery training, and
Okay.
then after I was a staff plastic surgeon.
Okay.
And so there were different hardships associated with that timing on both ends. My last year, I was deployed for almost 6 months, and so my children were young. Luckily, my husband was in a situation where he could kind of pick up and take over childcare. But we made it work, and my kids are okay, and my family is okay, and I'm very happy.
That's awesome.
Yeah, I'm happily single and with no kids, and I remember trying to get through my deployment was so stressful, having a power of attorney when you're young and figuring out who to give that to, and have to basically put your life on hold while you did your military service overseas based on your orders, and so it's very impressive that you juggled all of that.
Thank you.
Yeah, it's great. I also deployed when my children were young. I deployed when I was married, so not without kids as well, but I do remember there's a lot to factor in no matter what, because you are putting your life on hold for 6 months. But with regards to family planning, I get this question a lot from younger medical students and residents. Would you prefer to have your kids during residency, as a staff? Is there an ideal time?
Again, there are pros and cons, and having experienced both, I don't know if I would actually change anything if I had to do it over again. The military, interestingly, actually protected me a little bit once I transitioned to staff. I had 12 weeks of maternity leave and was able to take like all the time that I needed. But when you're first starting practice, you want that time to be operating.
Right.
So there's never really a good time. I think it more has to do with what's good timing for you and your family, not necessarily your professional career.
Yeah, I think my advice to younger women is to have children when you feel that it's right for you, because you can put it off.
Yes, I think it's key what you said, that the most important thing is it should be a good time for you and your family, and you shouldn't necessarily take into account what's good for everyone else.
Yes.
Right?
Yeah, it needs to be good for you. Let's talk about deployment a little bit, because we've all been deployed. And we've talked about the challenges for deployment on your families, what it's like to deploy for your home life, kids, spouses, just personally keeping your life together while you're gone. What is it like for you on deployment? What was your experience?
I think it was challenging to sometimes really be in an environment with less women when you're on deployment. But luckily for us, at least for myself, my experience was when I was in the Fleet Hospital during the deployment, we had other nurses, other female physicians that were still your colleagues. And so you do actually still have people going through the same things you are. And so you have camaraderie in that respect.
I think the hardest part about being deployed is you lose a little bit of the autonomy that you're used to when you're stateside, because you're not in that environment anymore.
Yeah, I've experienced both the environment of a deployment where it was a not wartime situation on a ship with Marines, which is its own environment. I was actually, it was the first time that this ship had ever had women on it, and it had 900 men and 5 women.
Wow.
So it was a little hard not to stand out in the crowd. But it was, I was a medical officer, one of the 2 medical officers for the ship, and again, it worked out fine. And then the second deployment was in a combat zone, and again, there were very few women on this base on our surgical team, but the camaraderie amongst our team was bar none, and really still fast friends with those surgeons that I worked with. Let's swivel a little bit to mentorship. Can you describe your mentorship experience and how that helped you get into plastic surgery?
I feel like I had to seek out a lot of different types of mentors and find different people to help me in different avenues of my career. And so, to me, it's not a bad thing that I don't have just one. I think I was thankful that I had so many people that were supportive and mentors to me.
Yeah, that's an excellent point, actually, with regards to mentorship. It's been shown, and they're publishing studies on this now, that team mentorship is probably the most effective way of building someone's career, so that you have mentors for different aspects of whether it be a research mentor, academic advancement mentor, maybe a mentor to help you in the military leadership pathway.
Definitely.
Because that has its own set of rules and regulations.
Sure.
And so that's really great to hear. What about you, Jennifer?
Similar. I've had male and female mentors. I've had mentors in plastic surgery, and Dr. Slazak is definitely one that comes to mind first. I've also had mentors in general surgery, and then mentors just in the military to show you,
Yes,
military
the
leadership.
rules.
And while I don't think you necessarily need to have a female mentor, I do think it helps because it can show you a path forward of kind of what you want your career to look like, whether it has to do with work-life balance or leadership among, a male-dominated field.
Yeah, I agree with that wholeheartedly. I was a department chair and sitting around surgical services, all the department heads, and then having another female ally to kind of reiterate what you just said is important. That's been shown to be effective in communicating your needs. What advice do you give women on being a great mentor?
Just being present. I think there are not a lot of female mentors. Luckily, they are increasing. But, being present, going to events, taking the time, reviewing a paper, being there is the most important thing.
I agree, and I think for me, trying to now be a good sponsor as well as a good mentor. So when there are requests for speakers, panels, even working on a collaborative project, I usually try to rack my brain to think of other female plastic surgeons that I can reach out to include, and try to become a good sponsor in that way.
Yeah, I think that is really important, and is a really effective way of creating more female empowerment within our field. So let's talk about the future of plastic surgery and right now in the military. What do you think people should know about being a plastic surgeon in the military? Like, what are the opportunities and how should they go about seeking that out?
So I think there are a lot of opportunities for plastic surgeons in the military. As you pointed out, plastic surgeons can be critical in wartime reconstruction, and anyone who's even at all interested should consider a career in the military, because I've had a great career so far, and I would recommend it to people.
I agree, as I still have friends that are still active duty in the military, and some of the work that they do, the surgeries, the innovations that they perform every day for the service members is just astounding. And I think they do such great surgical work and are the leaders in the forefront of innovation for plastic surgery as well as all surgery. So I think it's a wonderful opportunity that young people should consider.
If you think about the history of plastic surgery, military plastic surgeons have advanced the field leaps and bounds since it became a field.
I think the other thing about the military is that it's also gotten very good at collaborating with civilian counterparts to provide the best care for our service members. And so I think if you have an interest in reconstructive surgery and you want to be on the cutting edge of innovation, regenerative medicine, I think those opportunities are all there. And it's not even limited to your institution where you're practicing.
And I think it's amazing, the patient population you work with in the military. These are just amazing people. They're, elite athletes, obviously elite soldiers that get injured, and sometimes, again, even despite devastating injuries, their first question is, when do I get back with my people, my troops, my men? And it's your job to rebuild them so that they can get a very functional life, and some of them return to active duty. That's one of the most rewarding parts about working in military medicine, is that your patients are more active than you to try to get back to what they were doing.
Yes, the patients are one of the best parts of my job, I think. I mean, everyone, even the retirees, like they've bought into the system. They are part of the family. It's really great.
I agree. I feel like those patients are so motivated and just really grateful for their care and really want to partner with you to get the best care. And it's, bar none, has been the best patient population. So, Jennifer, do you have a professional motto?
Just take care of the patient. If you're taking care of the patient, no one will fault you for what you're doing.
That's what I always tell my residents. If you think you're doing the right thing, even though it's probably the harder thing to do, you're going to be doing the best thing for the patient.
Excellent. What career advice would you give a woman who wants to be where you are now?
I think what we had said before about being flexible. I think you always come through thinking you're going to have a certain path in a career. The way you envision it changes. I thought I was going to be a trauma surgeon, then I became a plastic surgeon, thinking I was going to be a craniofacial surgeon, now I'm a hand surgeon. You can try to plan and but your passions could change once you experience different things. And so I think you always have to still be flexible, but be persistent.
Excellent. Anything
I
to
would say-
add to that? That's pretty.
I would just say be persistent in what's important to you.
Why don't you tell us one of your proudest moments in service?
I think mine is just from after I got out, seeing my former corpsmen, the enlisted personnel, also going to college, becoming nurses and or doctors as well, and keeping in touch with them. And sometimes they tell you that it was working with me in the past that made them keep going. And so I think that's my proudest moment. And then beyond that, just keeping the great friends that I met in the military.
Excellent. You still have moments to come, but
I do.
as of now, what's your proudest?
I recently had an intern tell a colleague, a female intern tell a colleague that they went into surgery because of me.
That's
So
awesome.
Awesome.
That's the best compliment I've ever gotten.
That's great.
What about you, Dr. Gallus? Do you have a proudest moment?
I think my time when I returned from Afghanistan and then was taking care of the wounded warriors stateside, working with some of those patients was some of the most challenging and also things that I'm the most proud of, really working with these guys to do what we could to save their limbs at sometimes pretty extreme reconstructive surgeries that we got through, and then to help them through that journey, and then to see them on campus, you know, walking around, it's really inspiring.
That's amazing.
What do you think it means, Jennifer, to be a female leader in surgery in the military?
I think that you just have to know that you are always a role model to someone.
Mm-hmm.
And so even when you think that what you're doing doesn't matter or no one cares, someone's always watching and you're inspiring someone, whether it's a trainee or even a patient or a family member. You know, you always have to realize that you're always a role model.
That's so true. I remember the first few months when I was in the military as an ensign in the Navy, and I would sometimes at work walk by a mirror and be like, oh, who's that person? And realize it was me. And it's so true, you know, the patients, their families, junior people see you and they, you know, you have to be at your best behavior and, again, doing the right thing because everybody's watching. And so you're representing not just what you're wearing in the uniform, but hundreds of years of tradition as well. And then being a woman, having different challenges that you have to face, and then you might be the first one doing it, but hopefully you're not the last.
Definitely.
Awesome. This has been a wonderful and informative discussion. Thank you so much for participating in this Limitless initiative. We're really glad that we were able to set this up.
Thank you for having me.
It's my honor.